delighted to welcome all of you on behalf of Virinchi Development Services Private Limited. We are embarking on a new journey for realizing the goal of National Family Health Survey execution, round 6 in Meghalaya district. And for the first time, we are having it in Garo. The National Family Health Survey in India was initiated in the early 1990s, and the first Nfhs was in 1992-93. This is Nfhs 6, so we have completed 5 Nfhs rounds. So this Nfhs survey is basically conducted under the stewardship of Ministry of Health and Family Welfare, Government of India, with International Institute for Population Sciences, Mumbai, as the nodal agency, and the technical assistance provided by the United States Agency for International Development, USAID, and Virginia-based, global-based consulting and technology services company. They have been till now providing all the help. Now, the preparation of Nfhs starts much earlier than the survey. If we look into the history of Nfhs, IAPS has been conducting this survey, and we have completed about 33 years since we started. It's a long journey, and some of you were not even born then. So the first Nfhs was in 1992-93, second was in 98-99, third was in 2005-06, fourth was in 2015-16, fifth was in 2019-21. This was during the COVID period, and now we are in the 6th round. And it is, for us, is a very important feat that Nfhs 6 is being done solely by IIPS for the first time, without outside support. It's totally government support. So for us, it's an important thing. And for Virinchi, it's an important honor to be part with the government. The main objectives of Nfhs program have been to strengthen India's demographic and health database to provide information that is both reliable and can be relied upon.
God bless this Nfhs. Yes.
Virinchi Development Services Private Limited is one of the national level technical agency, lead national level technical agency, and we are currently, we have started this organization in 2011, and since then we are working across India. We are working with all the national as well as international organizations as well as Government of India and state governments. We have presence across 19 states of India, and we have our core expertise, basically research and study is one of our very, very core expertise.
In order to understand the issues of the maternal and then the child health problems, the mortality, the morbidity, and to check and to come out with the aid to help from the grassroots level. So this rescue mission is, it focuses on the increase in the institutional deliveries and the 4 ANC, which is a must for all the pregnant women, and to identify the pregnant woman in the first trimester. And the home deliveries, if happens also, it should be with our SBs, which are our skilled birth attendants. And to check on the teenage pregnancies, the anemia issues, nutritional issues, the maternal death, and the child death. All these issues are taken up, reviewed during this rescue mission so that our state can, even the department and the community can work side by side to bring about the reduction in the maternal and then the child health. Another initiative that has come out from the Chief Minister level is the CMSMS. We call it Chief Minister's Safe Motherhood Scheme. So this component has the transit homes where the pregnant woman, if they are far-flung areas, they can come in advance and then stay in those transit homes and then wait for their time of delivery, where they will be given food and they will be given all the homely, anything that they will feel at home. So all these facilities are given to them under this scheme. And also the attendants like the dais, the village dais, or the husbands or the sisters, whoever has attended them during their stay in transit home, will be given incentives also of 1,000 rupees. Also, we have the CM fleet, which is the transportation, the free transportation that has been there in the system, and also the mobility for our ANM, the support in the mobility to attend to the VHNDs, to see the immunization, to see the ANC checkups, antenatal cares. All these things are there in this CMSMS, which has been implemented more than a year now. It's around 2 years now. And there has been the 137 transit homes as of now, and we are trying to come up with more. And the pregnant woman in the transit home who has come and then availed this benefit, that is 1,893. So we have a lot of people who have got this CM fleet, also the free transportation. 20,194 pregnant women has been helped with this transportations, and so on and so forth. So another thing that we have is a mother app application that we have. So you all may be coming across when you go to the field to do your survey, and then you will be seeing this mother app happening out there. This mother app is online data that we can see, where we can see that the mother has been registered or not in the pregnant in the due list, or whether they are having which person is having a expected date of delivery, and all the list of the people who are suffering from anemia. All those things can be seen, and also that you can see the doctors and then the ANMs calling out from that mother app itself to the beneficiaries.
What I want to say is, we are going to publish one more new edition of National Health Survey 6. So you are going to be part of that, and it's not going to be very easy, as Madam has already mentioned. What I would like to advise you all is, the informations you're going to collect, or going to gather, or going to give are very, very important, and you have to be very careful collecting the informations, because this report is going to be a reference book for all over India. So when you go to the field, ask carefully, record carefully, so that nothing goes wrong, and it will be a perfect book for all of us to refer. I wish you all the best. Thank you.
We are very fortunate that this type of huge project is being taken up in our own place, and I want to thank the Government of India and institutions who is taking up this program, this task, huge task. Uh, I do not have much idea about how this survey will go on, but one thing I know and I sense that this is a huge task that is going to be taken up by you. So I will urge the participants, the students who will be taking part in this exercise, especially I would like you to be very attentive and very curious and to be very jealous in your learning and in the exercise in the field, because this data is going to reflect in the national scenario. So you have to be very responsible, because this data will reflect the status of our own place, of our own state. So it's a huge task, and it will be a very responsible job on your part.
I'm working with HIV people living with HIV/AIDS, and then I've been working in this field for the past almost 10 years now, and basically we are taking care of the people living with HIV/AIDS, their treatments, psychological supports, counseling, even testing, everything is like we're doing. And these are done free of cost in the district hospitals. So maybe I will be taking classes on HIV/AIDS, I think. So looking forward to meet you all again in the classroom, and whatever I know regarding HIV/AIDS and other related topics, we will be discussing it. So once again, thank you so much for this opportunity, and hope to see you in the classroom, and I wish you all the best. Thank you.
Nfhs survey, for that matter, is one of the most regular, most rewarded survey in India, and as you guys who are doing it in Meghalaya, I'll be really looking forward to get your insights about the district on the last day of the training, which is 24th June, if I'm not wrong. Yeah? Perfect. So during your presentations, I'll certainly be here. As much as possible, would actually deliver all the other commitments, and I'm giving you all support. I'm putting it out there that whatever is required, whenever you are on the field, you have my block teams which are under administration. You have the medical teams of the medical administration. Dr. Bijay is in charge for all these block teams as well. Anything that you require on the field level, please contact them. I will also be meeting them soon. I'll inform them about the survey that is being upcoming and going, and they'll extend whatever support is required. So what we also look forward to is that whenever you do these collections, these sample surveys, the intel that we get about the people who are being surveyed, the intel that they get about themselves, and the intel that we get about the particular areas being affected, it allows us to plan things very well. And hopefully after this 1 month is concluded, I believe that I'm at a very opportune time in the district in charge of this. When it gets completed, I will also have the opportunity to discuss and share with you, take your inputs to it and plan things accordingly. You are going to participate in one of the building blocks of the state in time to come. So this 1 month is as important for you as it is for us. We hope to see really good inputs from you. Again, last thing, anything is there, just drop in. Okay, you drop into the offices, you drop into our DC office or the block offices, and let me know. All right. Also, I'll share my number with Dr. Nandini as well. If anybody needs, whoever is here in the district ma'am, then they can be shared my number. They can always get in touch with me for any issue that covers up. Lastly, for some of the areas, people are not aware about such surveys being conducted, and sometimes they don't see the correct reason to it. So we'll issue the information notices, which you can then share with your local leaders of the village, the Nokma, Sardars, Rangbashangs. I believe individual districts will issue those notices. You can take them along with you, keep a copy, wherever required. You can fill in that data, give it to them that this has come from the district administration. Okay? So that's it. Thank you so much. All the best.